You've just returned from the doctor's office. He mentioned your cholesterol levels are a bit high and handed you a prescription for a statin, explaining it's the gold standard for protecting your heart health. But when you get home, you turn on your computer, and everything becomes chaotic. One article says statins are harmful to muscles and memory. Another claims that just changing your diet is enough. In the midst of it all, your dear nephew calls, excitedly telling you about a miraculous dietary supplement from Japan he just read about online. Ultimately, you sit there, prescription in hand, your mind a whirlwind of questions. You feel confused and a little scared. Who should you believe now? If this story sounds familiar, you are not alone. Millions of Americans your age face a similar sea of conflicting information every day. On one hand, there is the concern about the potential side effects of the pill you're holding. On the other, the silent fear of a sudden heart attack or stroke that could change your life forever. You worry about the symptoms of heart attack, wondering what a heart attack feels like, and dread the possibility of experiencing chest pain without knowing its true cause. It feels as if you're trapped between two unpleasant choices. This article was created to be your trusted companion on this journey. We won't offer extreme advice or empty promises. Instead, we will calmly examine the evidence together, decode confusing medical terms into everyday language, and most importantly, build a clear plan that addresses questions like how to prevent heart attack so you can confidently talk with your doctor and proactively take care of your precious health. Before we dive deep into cholesterol, let's talk about something even more fundamental. Something many people often overlook: inflammation. This isn't the kind of inflammation you see with a cut on your hand or a swollen ankle. This is a different type of inflammation, a smoldering fire that burns silently inside your body for years. To help you visualize, imagine your arterial walls are like a brand new asphalt road, perfectly smooth when you were young. Blood and nutrients flow along it easily, without any obstacles. Chronic inflammation is like persistent bad weather, day after day, attacking the surface of that road. It's not a big storm you can see, but more like relentless, harsh sun and acid rain, silently causing the road to crack and deteriorate. Over time, this harsh weather wears away the smooth surface layer. It creates tiny, microscopic cracks and rough patches, invisible to the naked eye, making the entire structure brittle and weak. Understanding this process is key to understanding what causes a heart attack. It is these very cracks, these small potholes on the superhighway of your blood vessels, that is where all the trouble begins, and the primary answer to the question, what are the causes of heart attack? So, where does this smoldering fire come from? It comes from the very choices we make in our daily lives. A diet high in sugar, white bread, and processed foods is like pouring a corrosive liquid onto the road every day. Chronic stress from work, finances, or family issues is like forcing the road to endure a relentless parade of heavy trucks passing over it. Sleepless nights mean that your body's road repair crew never gets a chance to go out and patch up the day's wear and tear. And excess fat, especially around the abdomen, doesn't just sit there. It acts like a small factory, constantly producing inflammatory chemicals and dumping them into your system. So you see, the smoldering fire of inflammation is what silently weakens your arterial structure from the inside. It is the first domino to fall. It prepares the battleground, making the blood vessel walls more vulnerable and stickier. Long before your doctor mentions a blockage, this invisible fire has been working tirelessly, setting the stage for more serious problems later. Problems that can lead to a cardiac arrest versus heart attack debate in an emergency room. Now that you have a picture of the road damaged by the smoldering fire of inflammation, let's talk about the role of cholesterol in this story. For decades, we've been taught an oversimplified story. There's good cholesterol, HDL, and bad cholesterol, LDL. This way of thinking is not only outdated, but also causes a great deal of unnecessary confusion. Let's try a new visualization, a much more accurate analogy. Stop thinking of LDL as bad cholesterol. Instead, picture this. Cholesterol is like an essential package used by the body to build every cell and produce important hormones.
It is neither good nor bad in itself. It is simply necessary. To transport these packages in the bloodstream, which is a water-based environment, the body needs to pack them into specialized trucks. LDL particles are those trucks. The real problem isn't with the package, cholesterol itself. The problem arises when there are too many trucks, too many LDL particles circulating on the road that has already been cracked and damaged by the inflammation we discussed earlier. When too many trucks are crowding the road, they can easily get stuck in the cracks and potholes. They bump into each other, get trapped, and create a growing traffic jam. In medicine, that traffic jam is called atherosclerotic plaque. This plaque, which is one of the primary causes of a heart attack, makes the road narrower. When it ruptures, it can trigger a blood clot, leading to a full blockage and the sudden, often unmistakable heart attack signs. This leads to an important question. How do we know how many trucks are on the road? The standard cholesterol test you typically get, called LDL-C, is like trying to estimate the total weight of the cargo on all the trucks. It gives us an idea, but it's not always accurate. You could have the same total cargo weight carried by a few large trucks or by countless small trucks. Clearly, the scenario with countless small trucks has a much higher risk of causing a traffic jam. This is where a new concept comes in. There is a more advanced test called apolipoprotein B, or ApoB for short. Think of ApoB as scanning the barcode on each truck to get an exact count. Every single LDL particle, each truck, has exactly one ApoB protein on its surface. Therefore, by measuring ApoB, we are no longer estimating. We are accurately counting exactly how many potentially dangerous trucks are circulating in your blood, giving a much clearer picture of your true risk and what is the reason of heart attack at a particle level. That is why many progressive doctors are now paying close attention to the ApoB number. It allows them and you to get a much clearer picture of the actual risk of blockage, rather than relying on just an estimate. Understanding the difference between the cargo and the number of trucks is a major step in helping you break free from the cholesterol confusion and truly grasp the story unfolding inside your arteries. With this new picture in mind of a damaged road and too many delivery trucks, let's return to the prescription slip sitting on your kitchen table. Why did your doctor choose a statin as the first solution? It's important to understand their perspective respectfully. Your doctor prescribes statins because they are a tool proven by decades of research involving millions of people. They are one of the most thoroughly studied medications in medical history. Their effectiveness in reducing the number of LDL trucks in the blood is indisputable, and in doing so, they significantly reduce the risk of cardiovascular events. They are effective, covered by most insurance plans, and are part of the standard treatment guidelines that all doctors are trained to follow. Essentially, they are doing their job with the most powerful and reliable tool that mainstream medicine offers. They are trying to protect you using the most widely validated method available, a method proven to reduce the causes of heart attack.
However, standard does not mean only, and it certainly does not mean it's beyond discussion. Your health is a partnership between you and your doctor, not a one-way command. You absolutely have the right, and indeed should, actively participate in the decision-making process. You can transform a doctor's appointment from one of passive listening into a constructive dialogue. Instead of just nodding silently or refusing outright, try a different approach. The next time you see your doctor, come prepared with a few smart questions. This is not to challenge them, but to show that you are engaged and want to be a partner in your own healthcare. You can start simply. Doctor, I want to better understand my situation. Based on all my metrics, what is my actual percentage risk of having a heart attack or stroke in the next 10 years? This question shifts the focus from a single cholesterol number to the bigger picture of your personal risk. Then you can make a proposal that shows your commitment. Could we possibly try a different approach for the next 3 to 6 months? I want to focus seriously on lifestyle changes, and then we can retest to see how the numbers have improved.
This shows your doctor that you're not just trying to avoid medication, but that you are willing to do the work to improve your health. For a deeper insight, you can ask about the tests we've discussed. Besides the standard LDL measurement, could we consider checking more advanced markers like ApoB or LPA to get a more complete and accurate picture of my risk and the potential signs of a heart attack down the road? And if medication is the final decision, don't hesitate to express your concerns openly. If I start this medication, what are the most common side effects, and how should we monitor them to ensure safety? Are there any supplements, such as CoQ10, that I should consider taking alongside the statin to help minimize the risk of side effects? These questions will completely change the dynamic of the conversation. You are no longer a passive recipient of instructions. You have become an active, informed, and engaged partner in your own healthcare. A good doctor will always appreciate and respect such a patient. Whichever path you and your doctor decide on, whether it's medication, no medication, or a combination of both, there is one undeniable truth. The greatest power to change your health remains in your hands. Pills can only do part of the job. The true foundation of a healthy heart and a long life is built from the choices you make every day, from your meals to your sleep. Consider these the irreplaceable pillars of your house of health. Before thinking about any other supplement or treatment, we need to ensure this foundation is solid. These are the S tier, the non-negotiables. First, let's talk about what you put into your body. Don't think of it as a harsh and miserable diet. Think of it as treating your body to nutritious gifts. The best proven approach over many decades is the Mediterranean style of eating. What does that mean? It's simple. Eat more real food. Make your plate colorful with green vegetables, bell peppers, and tomatoes. Use healthy fats like extra virgin olive oil, avocados, and nuts. And try to eat fatty fish like salmon or sardines a few times a week. To simplify everything, start with one small rule. Add one more color of vegetables to each meal. Just doing that alone is a giant leap forward. At the same time, gently reduce the things that feed the flame of inflammation we talked about: sugar, white bread, pastries, and processed packaged foods. You don't have to eliminate them completely, just think of them as infrequent treats rather than staples of your diet.
Next is movement. Again, you don't need to sign up for a marathon or hit the gym every day. For cardiovascular health, consistency is more important than intensity. Just 30 minutes of brisk walking a day makes a huge difference. It not only strengthens your heart, but also improves your mood, helps you sleep better, and controls your blood sugar. If 30 minutes sounds like a lot, start with 10 and gradually increase it. In addition to walking, add a few simple movements to maintain muscle strength, which is crucial as we age. For example, while watching TV, you can perform a few controlled sit-to-stands from your chair. It keeps your legs strong and maintains your body's metabolism. Finally, but no less important, is sleep. We often steal time from sleep for other activities, treating it as a luxury. But the truth is, sleep is one of the most powerful medicines. This is the time for your body's road repair crew to get to work. They clean up cellular debris, soothe the flame of inflammation, and patch up the cracks in your artery walls. Aiming for 7 to 8 hours of sleep per night isn't laziness. It's an essential biological activity for regeneration and recovery. Diet, exercise, and sleep? That is the foundational triad. Before you spend a single dollar on expensive supplements, invest your time and attention in these 3 pillars. Their combined power is greater than any pill you can take. Once you have built a solid foundation of healthy eating, regular exercise, and quality sleep, adding certain nutrients can be considered a smart upgrade to protect your heart on a deeper level. However, these are not magic pills that can replace a scientific lifestyle, but rather well-researched tools that help optimize the effectiveness of what you are already doing. 2 of the top nutrients that modern science particularly emphasize for heart health are vitamin K2 and magnesium. Vitamin K2, a name still unfamiliar to many,
actually plays a role as important as its sibling, vitamin K1. While K1 is primarily involved in blood clotting, K2, especially the MK7 form, has the ability to direct calcium in the body. Picture K2 as a sophisticated traffic controller, ensuring that calcium is delivered to the right place, your skeleton. At the same time, it has the task of clearing out stray calcium molecules, preventing them from accumulating in the arterial walls, which is a primary cause of age-related vascular calcification and hardening. This mechanism makes K2 a dual-action agent. It both helps keep bones strong and prevents blood vessel blockage. This is especially important for people over 50, when the risk of osteoporosis and vascular damage increases, as well as for those supplementing with vitamin D, because vitamin D increases calcium absorption into the blood. But without enough K2 to give directions, excess calcium can accumulate in the wrong places and cause harm instead of providing benefits. Although K2 has less effect on anticoagulants than K1, people taking medications like warfarin should still consult their doctor thoroughly before use. Along with that, magnesium, also known as nature's relaxation pill, is an essential mineral involved in hundreds of biological reactions in the body, from energy metabolism to nerve transmission and heart muscle contraction. Unfortunately, a large portion of the population is now deficient in this mineral due to depleted soil and diets lacking in natural foods. Magnesium has the ability to relax the smooth muscles of blood vessel walls, helping to lower blood pressure gently and sustainably. It also stabilizes the heart rhythm by regulating electrical signals in the heart, while calming the central nervous system, thereby supporting deep sleep and reducing the impact of stress on the cardiovascular system. People with high blood pressure, nighttime leg cramps, difficulty sleeping, or frequent stress may particularly benefit from supplementing with magnesium. However, not all forms are the same. Some cheaper types, like magnesium oxide, can cause indigestion with poor absorption. Better absorbed forms like glycinate or malate are often recommended, especially for older adults. It is important to start with a low dose to allow the body to gradually adapt.
In summary, vitamin K2 and magnesium are two strategic allies worth considering if you want to go further on your heart protection journey. They are not a substitute for healthy habits, but when used at the right time and in the right way, they can make a real difference, especially after the age of 50. Coenzyme Q10, often called CoQ10, is a vitamin-like compound present in every cell of the human body. However, its highest concentrations are in the organs that consume the most energy, such as the heart, liver, and kidneys. The primary role of CoQ10 is to participate in the production of ATP, the energy currency of the cell, inside the mitochondria, the body's tiny power plants. This is particularly crucial for the heart, a relentless organ that beats more than 100,000 times a day. To maintain this continuous beat throughout life, the heart requires a stable supply of energy, and CoQ10 is the premium fuel that helps make that happen. A noteworthy point is that the body produces CoQ10 through the same biochemical pathway that creates cholesterol. When using statin drugs, which are widely prescribed to lower cholesterol, this process is also affected. The consequence is a significant drop in the body's CoQ10 levels, leading to fatigue, muscle pain, or reduced performance in many users. That is why doctors are increasingly encouraging patients on statins to consider supplementing with CoQ10 to restore cellular energy and minimize side effects. Additionally, CoQ10 also offers significant benefits for older adults facing fatigue, exhaustion, or wanting to naturally boost their cardiovascular health. There are currently two main forms of CoQ10 on the market: ubiquinone, the older, well-researched version, and ubiquinol, the more easily absorbed active version, which is particularly suitable for older adults. While both forms are safe and effective, the right choice should be based on an individual's health status, age, and budget. Alongside CoQ10, another nutrient receiving great interest from the scientific and natural medicine communities is nattokinase,
a special enzyme extracted from natto, a traditional Japanese fermented soybean dish. Nattokinase stands out for its fibrinolytic ability, meaning it helps break down fibrin, the main component that forms blood clots within blood vessels. Under normal conditions, the body creates fibrin to stop bleeding from an injury. However, if fibrin is not cleared away in a timely manner, it can accumulate, forming dangerous blood clots, the direct cause of a stroke or heart attack. Nattokinase acts as a silent cleaner in the blood vessels, keeping blood flowing smoothly and reducing the risk of blockages. However, due to its blood-thinning properties, the use of nattokinase must be carefully considered, especially if you are taking anticoagulant drugs, such as warfarin, Eliquis, Plavix, or low-dose aspirin. Combining them without a doctor's consent can lead to serious complications like uncontrolled bleeding. Therefore, although nattokinase is a powerful tool for supporting circulation, safety must be the top priority. Consider both CoQ10 and nattokinase as two natural allies, not to replace a healthy lifestyle, but to add strength to your heart in the most sustainable and proactive way. After solidifying the foundation and considering the Tier A allies, we can take another step to look at some Tier B supplements. These are the potential supporters. They can be very useful in specific cases, but they are not for everyone and are not the starting point. Think of them as tools for fine-tuning after you've gotten all the basics right.
One of these is P5P. This is the active form of vitamin B6. To understand why it's important, we need to know about something called homocysteine. Homocysteine is an amino acid in the blood. When its levels get too high, it can act as an irritant, damaging the delicate lining of the arteries, similar to how chronic inflammation causes harm. P5P, along with vitamin B12 and folate, a form of vitamin B9, are the key tools the body uses to recycle homocysteine, keeping its concentration at a safe level. The benefit of taking P5P instead of regular vitamin B6 is that your body can use it immediately without needing to go through a conversion step. If your blood tests show high homocysteine levels, discussing P5P with your doctor could be a smart move. Another potential supporter is astaxanthin. This is one of the most powerful antioxidants found in nature. If we liken inflammation to a fire, then antioxidants are the firefighting team that extinguishes the small embers before they flare up. Astaxanthin is the pink-red pigment that gives color to salmon, shrimp, and flamingos. Its antioxidant power helps protect the body's cells, including the cells lining the arteries, from damage by free radicals. Some studies also show it can help protect LDL particles from being oxidized, a critical step in the formation of plaque, and it also has anti-inflammatory properties itself. The most important thing to remember about this group is that they are not magic. These are advanced options, not a starting point. Supplementing with them is like a carpenter using specialized tools after having already built a solid frame for the house. Ensure you have built a solid S-tier foundation, diet, exercise, sleep, and have discussed the appropriate A-tier supplements for you. Always, and we cannot stress this enough, discuss these Tier B options with your doctor or a knowledgeable health professional. They can review your specific tests and help you decide if they are truly necessary and safe for your case. After reading all this information, you might feel a bit overwhelmed, and that's completely normal. When faced with so many new options and so much new knowledge, we often have a tendency to want to do everything at once. But remember, you don't need to and shouldn't try to boil the ocean. Instead, start with small, simple, and most importantly, sustainable changes. It is the small victories, repeated daily, that form the solid foundation for creating a major change in your health in the long run. A gentle plan for the first 2 weeks might be all you need to get started. In the first week, spend 20 minutes each day walking. Add a serving of green vegetables to your dinner, and make sure you drink enough water throughout the day.
In the second week, increase your walking time to 30 minutes, try to eat fatty fish like salmon or sardines twice during the week, and notably, proactively talk with your doctor about supplementing with magnesium to see if it's suitable for your condition. As you take the first steps on this new journey, doubts may arise. You might remember people like Warren Buffett, who has lived a long and healthy life without a strict diet or exercise regimen. Are all the efforts you are making really necessary? The answer is yes. People like Buffett are rare exceptions, the genetic lottery winners. But for the rest of us, the 99.9%, health doesn't come from luck, but from being proactive, knowledgeable, and taking conscious actions every day. Betting your health on luck has never been a wise strategy. Remember this, the knowledge you have gained today is power. You are no longer a passive passenger on your health journey. You are the driver, the CEO of your own body. From now on, you can absolutely walk into your doctor's office with intelligent questions, make the right daily choices, and design for yourself a life that is healthy, full of energy, and sustainable. You absolutely deserve it.